Can the panel discuss how sepsis protocols or bundles confound COVID patients and the best way to navigate these treatment bundles, especially related to fluids? I'll let Dr. Davison take that one.
Yeah, I mean, I think when a patient presents to the ER with a respiratory failure that appears to be, secondary to COVID, or at least you're suspicious that's COVID, I think it's very reasonable to use a sepsis bundle in that scenario. We talked about this, at length. These patients are, first of all, these patients are likely coming to the emergency department about 5 to 7 days after their symptoms started. That's when we know, about 7 days, when their symptoms become worse, and that's when they're coming to the emergency department. And at that point, there have been a lot of insensible losses. They've been breathing hard. Many of them have been febrile. Again, a lot of insensible losses. So I think the 30 cc's per kg is very, very reasonable at that moment. I think getting cultures and giving the antibiotics early, at least initially, because we aren't sure if they're COVID or something else, is important. And then following your lactates in the sepsis bundle. I think once they've been diagnosed with COVID, then you can start narrowing your antibiotics and start clearly taking your antibiotics off if you don't see any superimposed infection. But I think early on, I think that the sepsis bundle, particularly the fluid management, works quite well.